So you have calcific tendinitis. This type of tendinitis is generally in the shoulder more than the hip. It's not to say it can't happen in the hip. Also, it happens more frequently in women 40 to 70. Now, who are those women? They sound like women that have hormonal changes, but anyway, carrying on. Calcific tendinitis is caused by an accumulation of calcium hydroxyapatite crystals in periarticular muscular attachment sites. It most often occurs in people aged 40 to 70. Risk factors include trauma, which could be repetitive, so acute or chronic, metabolic dysfunctions, autoimmune, rheumatoid arthritis. It most often occurs in the shoulder. With the calcific tendinitis, it has been lesser reported in the hip, but if it does, it happens in the glute med. In calcific tendinitis of the glute med, patients will usually have a outside of the hip, lateral hip pain with limitation of movement, abductor weakness, and they usually have a gait abnormality. They'll have a lurch because it hurts to put weight on that leg. Are you ready? It looks like a marble is stuck in her glute med. Normal hip, calcific tendinitis. Now listen, that is a huge... It doesn't always look that big. In the shoulder, it looks a little bit smaller. It looks a little different. So this lady had right hip pain, 1 year duration, mainly climbing stairs, which makes sense because as her leg is going up, that tendon, that muscle is snapping over the bony prominence, and that is irritating. So what do we learn from this teeny tiny case study? Well, the first thing is you got to diagnose the calcific tendinitis. And then second, what do you do with it? So for this particular article, they're talking about the glute med. Because it is calcium and calcific, it will show up in imaging. It will show up in your x-rays. It will show up in actual films. This is why going to the doctor and talking to them about your problems is helpful. Now, we don't just diagnose based on diagnostic imaging, but they would also have, for this calcific tendinitis of the glute med, they would have tenderness over the greater trochanter. They'd have a painful gait. They have a positive Trendelenburg test, which is a sign of the glute med weakness. And so this is very, very rare. Okay. It is not very common. Common issues of the glute med is more likely to be a tendinitis or a partial full thickness tear or a full thickness tear. Those things happen more than this. But I just want you to know it does happen. I have a lot of women ask me about this. And so the option for treatment is usually conservative treatments like NSAIDs and physiotherapy is recommended. But if you saw the image, no amount of PT is going to make that calcium deposit go away. And that is a space occupying lesion that is going to cause a change in how that muscle pulls. So of course it's painful. And in this particular case study, they did surgery and it makes sense. That thing is huge. That cannot feel good. Every time that muscle contracts, it is moving around and touching things that wasn't supposed to even be there. So your hip pain is probably not this, but for those of you that have it,